Happy Thursday afternoon, everybody. I'm Sherry Cosme, the director of the ANCC Practice Transition Accreditation Program and our newest credentialing program, this Advanced Practice Provider Fellowship Accreditation. It is my honor to have you guys joining us today to hear from one of our amazing newly accredited APPFA programs from Community Health Network, Lori Vasquez. Before I turn over the microphone to her, for her to tell you their story of how they learned about APPFA, how they went on this journey, I did want to just do a PSA. We at the ANCC are hosting our Transition to Practice Symposium at the end of April in wonderful New Orleans. And I will hit send on the link in the chat here so that if you're interested in coming to a 3-day event that is, I'm going to say, star-studded with the best of the best of best practice ideas, great keynote speakers, this is a place to be. We also will be hosting an APPFA workshop at that event, which is our only in-person workshop this year. And it's a way for you to hear from the horse's mouths, aka myself and my team, what the standards mean, how you can meet them, etc. And so it's a great way to have, I'm going to say, physical contact with people since we live in these boxes so much and talk to computer screens so much of our day. So it's a great way to have that human connection. So with that, I am going to turn over today's presentation to our amazing program director, Lori Vasquez, to talk to you about her journey on APPFA. Take it away, Lori.
All right. Well, thank you, Sherry. I appreciate that. I'm already registered for the conference, so I hope that some of you will join us there. It will be my first conference, and I am very much looking forward to it. My APP executive and really my colleague Barb and I will be presenting at the conference as well, so really looking forward to that interaction. Well, I appreciate the opportunity to share today, and I really opted to do this because I was a brand new director when I was literally handed the self-study to start this accreditation process, and I was overwhelmed, to be very honest with you, and I'm a team of one. So as I kind of thought about this opportunity, I thought there's got to be somebody else out there like me. And so I really wanted to share our journey so that you can see that if I can do it, you can do it as well. So first of all, my name is Lori Vasquez. I am the director of our APP Fellowship Program and of Professional Development for Community Health Network. We are located in central Indiana, in the Indianapolis area. We have 5 hospital campuses, and I am very proud to say that we employ close to 700 APPs. So we are very APP friendly, APP powerful. So to have this fellowship program was a huge asset for us. Let me tell you a little bit about my background, and this is not to brag, but just to highlight my experience and my lack of experience when it came to accreditation. And again, some of you may relate to this. I've been a practicing PA for over 20 years in the field of bariatric surgery and general surgery. So I actually work for the same surgeon who I met on my clinical rotations from PA school. We kind of joke all the time that I just never left, even though I did graduate. When I started with him, I started in private practice, and then we became employed in the great overtaking of all private practice. We became employed by Community Health Network in 2012. As an APP, we have several competing hospital systems in this area that I have worked in and respect them, but as an APP, Community Health Network is just by far the best place to work. I still practice 2 days a week. I do practice 1 day clinically, seeing patients in the office, and then I assist 1 day a week in the operating room. Community Health Network is not an academic center. We do have a couple residency programs. So full disclosure, we have residency programs in psychiatry, podiatry, and family medicine, but we are not affiliated with a university. We have a couple partnerships. We partner with Marian University's School of Osteopathic Medicine, and as well as Butler University's PA program to provide specialty rotation sites for both PA students and medical students to complete. I did graduate from Butler's PA program. I've kept in touch with them for many years. And for the past 10 years, I've served as a preceptor for them. For 7 years, I've worked as their clinical instructor for general surgery. So I do have some ties to education. I teach once a month for Butler. So I did, coming into this role, while I didn't have a lot of academic experience, I do have a lot of experience in education, working with APP students and then teaching in their program. About, I would say 5 years ago, Community Health Network executives made the decision to hire an APP executive and build an APP leadership team. So our APP executive, and I'll reference her several times this afternoon, her name is Barb. She approached me probably 4 years ago and asked me, it kind of tagged me to be the APP lead for surgery. It was a volunteer role. She was building a leadership team. Eventually, about 2 years later, she was able to convince the powers that be that we should be compensated for our work. So started as a volunteer role and then moved into a 0.1 FTE. But our APP leadership team meets monthly. We represent our product lines. We help guide some decision making for APPs and disseminate APP information to our colleagues. In May of 2022, I finished my doctorate. And of course, I have a good relationship with Barb, have a good relationship with our leadership. And so they approached me when the director of the APP fellowship role came available to see if I would be interested in applying. Our inaugural director, her name was Amy. She had elected to take a promotion and a different role in the network. And so that is why the position was open. So I had a very difficult conversation with the surgeon who I work with about cutting back my clinical time. But I did apply for, and after what seemed like 25 different, very rigorous interviews, I was offered the role, and I started exactly 1 year ago this week. So I've been in my role 1 year, and at Community Health Network, my role for this is a 0.6 FTE. So, all right, let me tell you just a little bit more about our fellowship program and just kind of how it's gotten to where it is today. So our APP fellowship program was proposed by our APP executive vice president, Barb, who I've referenced, and she had created an advisory board in early 2020. And this all started to come together right before COVID, because at the time, our primary care product line was growing exponentially, and there weren't a lot of experienced candidates out there. And so our recruiters would bring a new APP to the practices, and the practices were just hesitant to bring in a new grad. They just felt like it was too much ramp up time. There would be decreased productivity. It would take not only would it take the APP a time to get started, but also the physician collaborators would be taking away time from their schedule to train them. And so Barb proposed that we build a fellowship program so that we could really address some of these issues. So one thing to know, our APP fellowship program is a little bit different from traditional programs. I know some fellowships will bring a new grad in, pay them a lower salary, train them, and then if there are opportunities in the network, bring them on. All of our APP fellows are employees. They are hired. They have a home site practice. They've been interviewed by that home site practice and chosen, and they are paid their full salary and benefits from day one, even during the time they're in the didactic portion of our fellowship, which I'll talk about in a second. So that's a little bit about how we started. Our inaugural director, I referenced Amy. She had extensive experience in education. She had been in the academic world. She is a nurse practitioner. She had her PhD. She designed this program. So I'm not going to take credit for it, but she designed the program. And she designed the program with all of the intention of obtaining accreditation. She had worked at Indiana University. She understood the accreditation process and what components would need to be built into a program. So she set it up from the very beginning that way. Our first cohort started in May of 2021, so it took us a little time to get the ball up and running. Of course, COVID didn't help, but our fellowship is 1 year in length. It's 12 months. It's completed in 3 phases. We have didactic education, we have clinical rotations within our specialty product lines, all with trained network employed preceptors. And then once they've completed those first 2 components, then they go to their home site practice for home site orientation and onboarding. They're also assigned a mentor at that time. Throughout the fellowship year, a couple things that we do while they're fellows. We have a program at Community Health Network called Serve 360. And so actually the very first week they're in the program, really our first meeting in person, we go do a service project together. And for me, it gives us a way to quickly get to know each other and bond, but we really want them to know what it means to work at Community Health Network. We're a very service-based orientation. Also throughout the fellowship year, we do workshops on procedures, radiology, EKG, and they're given a lot of provider well-being training. And then, of course, I check in with them on a monthly basis, as well as our primary care APP lead as well. We have 3 fellowship start dates per year, so we do not run a rolling start. We start February, June, and September. That's how we do it. And we are getting ready to launch cohort 8 in 2 weeks. We've trained 36 APP fellows to date. So really exciting to be a part of this. All right, let's talk a little bit about you setting up your program. And this is just my advice. If you are at the very beginning in setting up a program, I would tell you to start with the standards. If you go to the APPFA website, there are so many resources that you can download, the application manual, the getting started guide, the readiness bundle. Even though our program had been set up, this was my first stop because this helped me know, let's look at this box. Let's look at these components. Let me make sure, even though I know the program was built around this, let's make sure that we really do have all of these pieces and parts. The readiness bundle is amazing. It has an eligibility criteria form that basically lets you quickly audit your program and see if you're eligible for accreditation. And then if you want to dig even deeper, there's a gap analysis tool that can kind of help you see if you're missing any pieces as well. I would tell you, form an advisory board or investigative committee if you're at the beginning. You cannot do this on your own. Our APP executive put together some of her APP leaders. They researched, gathered cost of productivity data. They wrote a comprehensive business plan that they were able to then present to our executive leadership in support of an APP fellowship program. But then once in place, your advisory board then can help you stay accountable, review your data, identify any weak areas, help promote your program. I meet with my advisory board on a quarterly basis, and they've been so helpful to me, even just spreading the word about our program. Getting buy-in from executive leadership is really important. I think I've mentioned I work for a great healthcare network that values APPs. Our CEO and our executive leader when they speak in front of our all provider meetings, they never say physician only. And it's something I'm very proud of. But they have been very supportive of APPs. They reviewed the business proposal. They didn't really even have to think about it. They saw the benefit to it. And they approved the program right away, and they continue to be very supportive. We even meet with our executives. We meet with our vice president on a monthly basis just to update him on the fellowship, and they continue to want this program to be present. As you develop the didactic portion of your program, you do have to build a curriculum and decide how you're going to approach this. Are you going to use in-house faculty, use an educational partner? I mentioned we're not an academic center. And so we do have excellent physicians and excellent APPs who love to teach. But thankfully, our initial director really was aware of the challenges of keeping curriculum up to date, ensuring that it was evidence-based, ensuring that most of our in-house physicians are on a productivity model. And so we knew they might be hesitant to give up, consistent time to teach or lecture. And so our leadership then made the decision to approach one of our local universities, which happened to be Butler University. They approached their College of Pharmacy and Health Sciences to see if they would be willing to develop a transition to clinical practice curriculum for us. Butler agreed, and they utilized faculty from their Master of Physician Assistant and their Doctor of Medical Science programs to put together an 8-week curriculum that focuses on key internal family medicine topics, as well as population health, health promotion, and disease prevention. All of their coursework is virtual with several live synchronous activities. The fellows know the course is very rigorous. It takes them 36 to 40 hours per week to complete. And so we do carve out 8 weeks for them, and they are paid during that time. All of our APP fellows who complete the course, they do receive 90 Category 1 CME hours. We do use some of their CME money to pay for this program, and they also receive 12, they receive a certificate and 12 transferable credit hours that for a doctoral program. So that's been a win for our APP fellows. We've loved our partnership with Butler. It's been nice because we've been able to have them kind of tweak the curriculum to our needs and adjust it based on our APP fellow feedback. But you may not have access to an educational partner like we do. And if you don't want to use in-house faculty, there are some virtual programs that offer transition to clinical practice for APP courses. I won't advertise for them, but a quick Google search, you could probably find some. Probably another thing after building your curriculum, you've got to recruit your preceptors. Those rotations are really crucial to building that network and training. And so when our program was set up, one thing, again, about our initial director, she had pretty extensive background in adult learning principles. And so she used our network marketing department to write and film an e-learning module in-house to train our preceptors. And so this is a really nice tool that we have. We have an e-learning platform that any provider can log into and take courses. So our preceptor training is on that. She, as part of that training, she interviewed several physicians and APPs within the network who were already working as preceptors and kind of asked their advice in an interview style, and then built in some information on how to be effective as a preceptor using some of those adult learning principles. She even included some practical advice on create a space for your APP fellow or your student. Have questions prepared. One of the things that we've done is that we've asked all of our different specialty areas to create something that they can give to their APP fellow that's special to their specialty. So For example, in behavioral health, our behavioral health team put together algorithms for the treatment of anxiety and depression. And so we give those algorithms to our APP fellows just as something that they can ask questions on. It kind of gives them a talking point, but also gives them something they can take with them as a reference material as they get started in practice. Another thing that's important is make sure you create evaluation forms for your preceptors and your APP fellows. For both the preceptors to evaluate your fellows, but your fellows to evaluate your preceptors. We had a situation the first month I started, I was looking at these evaluation forms, and one of our cohorts were rating one of our GI preceptors very low. But I knew this preceptor really well. She served with me on our leadership team, and I was a little surprised about the evaluations. So I set up a meeting with her to talk about it, and the preceptor shared with me that her primary technique to help fellows learn was just to drill them with questions, because that's how she had learned best. But when she saw the evaluation form, she changed her approach slightly, and she's actually had great reviews since. And 2 of my recent fellows marked her as their favorite preceptor. So those evaluation forms, they're important for accreditation, but they're also important to help you continue to refine your program. And probably the most important thing is to educate your organization. I still do this on a weekly basis. We're a big network. And even though I feel like everyone should know about our APP fellowship, they don't. And so we meet with our recruiters every month to make sure that they have the most current information on the fellowship program. Then we also know what positions are open and available. If we want to go and talk to that practice and even, try to convince them to consider hiring a new grad, and we'll help train them. We're willing to do that. As the fellows are hired, the first thing I do is reach out to the fellow, the practice manager, and their collaborating physician, because I want to establish that line of communication from the very beginning. But also we provide them with some resources on, kind of how should you work with your APP fellow? Here are some recommendations for ramp up time and onboarding. We had some fellows come back and say they just didn't feel like they were getting what they needed from their collaborating physicians. So I took this to my advisory board. And on my advisory board is a primary care physician who had taken a fellow early on. And so she really is very passionate about this. And what I loved is she and I sat down separately, and she helped me write some language directed toward physicians, basically reminding them that, hey, you were a brand new physician once. You had to start somewhere. Somebody helped you. Remember that when you are training your APP fellow. And I really appreciated that insight, from one physician to another. We also use our marketing department to provide regular communication across the network and to educate people about our fellowship. Also, very important that you set goals for your fellowship. It's important for your own accountability and data, but for your accreditation process, it's really important that you have measurable goals set up. And I'll talk about that a little bit on our journey. But our initial goals focused on ramp up time, productivity, and retention compared to prior new grads who didn't have the benefit of the fellowship, as well as each individual APP fellow's comfort level with a variety of medical topics before and then after their transition to clinical practice course. So those were some of the goals that we set initially. And I will try to move my mouse over here. I'm so sorry. Here we go. All right. Here's what you really came for. Let me talk a little bit about our journey. So our timeline, I told you our inaugural director had set up the program, and she had identified APPFA as the accreditation that we should pursue, primarily because we do train both NPs and PAs. And so APPFA allowed for APP accreditation and not just nurse practitioner, not just PA. She shared this with our APP executive, but then just the timeline, the way it worked, she took that promotion and transferred. And I had been hired, but I had contractual obligations as a clinical PA, so I couldn't start for 90 days. So there was a several month gap where our APP executive filled in as the director of our APP fellowship program. Thankfully, she also has significant experience, has been through the process of an initial accreditation for a midwifery program at a university where she previously taught. So she was excited and she submitted that application in January of 2023. Our application was accepted and we were sent the email. We had our welcome call and we were sent the email containing our self-study. And we joke that I walked in on my very first day and she handed me the self-study and said, good luck, which is not really true, but it was a bit overwhelming. I was brand new in my role. I had never seen anything like a self-study. I had never written anything like a self-study. I had done my doctoral program and I had written some research papers and business plans and QI projects, but not a self-study. I didn't really know the program that well. And we simultaneously had a brand new cohort that I was going to be in charge of starting 1 week after I first started. And so I needed to get them up and running, start getting rotations scheduled, work with our educational partners. So I was a little bit overwhelmed. At the same time, we were also working with our foundation on some grant writing. So it was a lot. It was a lot to walk into. Like I said, I'm the only staff. It's just me. So I don't have an assistant or a coordinator or an assistant director. And so I knew that we had a large task in front of us, but thankfully our APP exec spent a lot of time with me in those early days, orienting me to the program. She gave me all the materials, background information that I would need. And she and I just divided the self-study in half and we each took half of it. And that was, I'm so grateful for that. We wrote separately and we wrote together and we checked each other's writing and facts throughout the entire process. And we submitted our self-study in early May. And I said, oh, I'm so thankful to have all of that writing done and behind me. I think Barb and I celebrated. And then I didn't plan for one thing. And I didn't plan for the fact that APPFA would review the initial submission, but then could ask us for further information or rewriting sections of the self-study. And honestly, we had a lot that we had to rewrite. And we had about 2 weeks to get this done. And this was in May. So on a side note, this was an incredibly busy time for me. I have 2 boys. It was the end of the school year. Both of my boys are in spring sports. My oldest son's lacrosse team made it to the state finals. I had other responsibilities and obligations going on. It was very stressful and I did not get a lot of sleep. And so as you think about your timeline, I would really, really encourage you, don't just look at each little date, look at the whole picture. Because if you know that you have a 2-week vacation, scheduled in May, maybe that's not a good time for you to plan to have your self-studies submitted, if that makes sense. So just really, I would encourage you really scroll back and look at that whole timeline. We got it all done. So we submitted our rewrites, they were accepted. We were offered our virtual visit dates. We picked our virtual site visit to happen at the end of June. And then between May and June, our APP fellows, the ones that we had previously trained, were asked to fill out a survey for APPFA. And I'll talk about that in just a little bit. But we did our visit, we waited through July and part of August, and then we were honored to be awarded our APPFA accreditation with distinction in August of 2023. Some resources, and I mentioned the welcome meeting, but some things that I really found to be very helpful. Our initial welcome meeting was very helpful. It's great to meet the APPFA staff and kind of put a face with a name, but they really helped us get the ball rolling. They were incredibly responsive throughout the entire process. Whenever we had a question, when I did things wrong and didn't email them with my APPFA number, they still listened to me. And so they didn't kick me out. So I would encourage you, use that as a great resource. And then the APPFA website was really, really beneficial to me. I think that I kept that website open for 6 months straight on my browser tab. But I really did use all of those tools. So for the self-study, just know this is a big project. Unless you've been through an accreditation process before, you've probably never seen anything quite like this. It's really important that you get your information and data up front. It'll help you not to waste any time searching for things when you're doing your writing. It's hard to do on your own. If you can, phone a friend, have a barb like I did. Even if they can't write for you, have them read and use the self-study review to help you see the things you might be missing. Make sure you give yourself plenty of time. Like me, some of you may work clinically still, so you really need to set a timeline, block hours on your calendar for writing. Something silly that messed me up was needing access to Adobe Acrobat Pro. There is something when you submit your self-study, it needs to go into Adobe Acrobat and it needs to be bookmarked. I had Acrobat on my computer, so I didn't know that I needed a different version. My version didn't do bookmarking. And something that I should let you know is if you're in a large organization like mine, you probably know this, nothing happens quickly. I reached out to IT thinking, oh, they can just put it on my computer. No, they explained they only had so many licenses for this product. I would have to go through an approval process. I had to complete forms, have them approved, and wait for IT to get back with me. When they did, they told me it would take 7 to 10 days for them to put it on my computer. And we were literally with under a week to go before we had to submit. So I did have to beg. I might have given away my firstborn child, but they did it more quickly and I got it installed 36 hours before our deadline for submission. I also had never done any bookmarking. But APPFA has great tutorials for this. Once you are given that self-study, you're also given some additional tools. I watched those tutorials several times and now I'm an expert. Not really. But anyway, that is just something that I know that's silly, but that was part of our journey that might be beneficial information for you to have. The writing style, again, I'd never written anything like this. And the writing style for a self-study includes one question with 2 parts. The first part, you kind of essentially write as a policy with very generic information. And then the second part, you write very specific information about how your program accomplishes that policy. It seemed very confusing and extremely redundant to me, to be very honest with you. And so when I first got started, I tried writing this, but I just wasn't sure where to go. And so I said, you know what, I need to talk to someone who's done this before. And so I reached out to one of my colleagues at Butler. She had walked through an accreditation process before, and I also knew that she was a reviewer for ARC-PA, the governing body for PA programs. And so she kind of helped me explain the self-study, and she provided me some examples of writing style. Now, they weren't the same writing that we would do for an APP fellowship program because it was more for when you're starting a PA program, but it really helped me understand what I was supposed to write or how I was supposed to write. SMART goals. Part of the self-study includes detailing your program's SMART goals, and SMART is an acronym. If you're not familiar with SMART goals, You should definitely understand the components of this. I was really glad we'd covered this in my doctoral program, but just something you should know, that APPFA does provide you with some templates, so you don't have to be a graphic designer in addition to an expert writer, so that you can load your SMART goal information into that. And that's what we did when we wrote our self-study. And then I mentioned this earlier, but make use of the applicant colleague self-study review. Once you've written each section, have a colleague read it, and just make sure that you answered all of the required elements. I think that was a really helpful system of checks and balances for me. The APP Fellow Survey, briefly talk about this. This happens in between when you submit your self-study and before your virtual visit, and it is required, and it's based on the number you put on your application. So if you said, we have trained 18 APP Fellows, then the APPFA is going to create a percentage. You need so many of these 18 to respond to this survey. APPFA sends a survey link. We sent it out to our APP Fellows, and then that data goes to APPFA for their review. And we got the information from them later. But this survey is important, and I would just encourage you, we reminded our fellows frequently to fill this out. APPFA is very kind, and they kind of let you know how many have filled it out each week, which is very helpful. So we kind of gave our fellows a false deadline, knowing that the real deadline was 10 days later. But that really helped us make sure we got as many completions. We met that percentage. The virtual visit. So once you choose a date for your virtual visit, just make sure you block everybody's calendars. We reached out to our leadership's team, executive assistant. She made sure they were available. We recruited more people than you needed. You need preceptors and fellows and practice managers, and we made sure that we had more than we needed just in case. I'm glad we did, because we did have a practice manager who was unable to attend at the last minute, and so we kind of had somebody waiting in the wings. I would also tell you, prep your participants, explain the purpose of the visit, prepare them for what they might be asked about. Don't coach them or give them words, but kind of clue them in. Technology. Since it's a virtual visit, you're relying on technology that's sometimes unreliable. Be sure to plan for those backups. The day before our virtual visit, we had a huge storm in Indianapolis. We're not in a rural area. We're in a large city, and we had several areas of the city without power for an extended period of time. There was a location near the hospital that was without power for about 72 hours. One of our practice managers even had to drive to another location so she could log in. So plan, prepare, have a backup. We secured a conference room, even though it was a virtual visit, and we were logged in on one laptop, and we had another one ready to go just in case. So, and then the reviewers, the virtual visit reviewers, they are not there to decide solely if your program passes or fails, but they want to get some highlights and clarifications. Listen to your program. I'll tell you, the virtual visit probably was the highlight of my entire year as a fellowship director, because listening to our practice managers, our fellows, our preceptors, our executives just brag on our program and talk about their experiences. I was almost emotional during that virtual visit. And so it was really, that was it. As to me, I went into it being a little nervous and scared, and I came away with it going, wow, this is amazing. So, all right, I'm almost done here, but let me just kind of highlight a couple things that we learned. What we learned is highlight what's unique about your program, what you do well, what your successes are. For example, we integrate extensive well-being tools into our program, and we offer some things to our APP fellows that we know no other program likely offers. We really highlighted this, and this at the end came out to be something that was very special about our program. We were also able to show some great data on ramp-up time and productivity, and the positive financial impact that our fellowship had. But in addition to showing off, it's okay to admit your areas of weakness. one of the questions the reviewers asked me was about my goals moving forward. And I honestly hadn't even thought about it. So I rambled off something like, oh, we'll continue to measure productivity and retention. But, they really pushed me and they said, come up with some new ideas. And having that outside input can really help improve and refine your program and challenge you. Organize, organize, organize. You've probably heard me say this 13 times. For me personally, I put everything together in a team in Microsoft Teams. And this is the way it helped me. But it helped me quickly find information, our standard operating procedure, all of our forms, our master list, all of the supporting documents I put into one place so that when we were putting together our self-study, I just had one reference point. And then set that timeline. I'm a little bit of a procrastinator by nature. Although I think there's a study that links procrastination and success. But my APP executive and we wrote a lot after hours, late at night. Ironically, we wrote so much on a well-being retreat. I wouldn't say that was well-being, but we had to get it done. But we did stick to our goal and we got our self-study completed a couple days prior to submission so that we would have time to take a break and then go back and review it. And really something, and I tell my students this all the time, APPFA does not want you to fail. Just the same way when you're in PA school and you have to do a summative exam at the end of your career, they don't want you to fail. They want you to succeed. They've prepared you for this. But they do want to make sure that they uphold a high standard so that accreditation actually means something. So I'm going to give you an example. Remember I mentioned that we had a practice manager that couldn't do it and had to step in? Well, I'd sent her information ahead of time, preparing her for what this virtual visit was, but I don't think she read it. And she got on and she was in the very first, within the first 10 minutes of our virtual visit, she was asked a question and she went off about the terrible experience that she had had with an APP fellow and there was no communication and this and that. And I was mortified. I was freaking out. I was sure that, oh, this was going to be it. We're not going to get our accreditation. But, at the end of the day, the rest of our visit went well. And I think that we demonstrated that we had made some clear changes prior to that happening. And that we clearly did not coach our people on what to say. So don't freak out if something like that happens to you. And then finally, and maybe most importantly, celebrate. When we got our accreditation, we were very proud. We sent out network news release. We hosted a reception. In this picture, you'll see our CEO of Community Health Network, our executive vice president, one of our Butler representatives, Barb, and me. And that was a really fun day. And finally, I love to share my journey. I do not look at this as competition. I look at this as collaboration. In my mind, when we are building these programs, we are truly trying to enhance education and ultimately patient care. So if I can be a resource to you, please reach out to me. There's my email address. You can look me up on LinkedIn, and I'd be more than happy to help you. But thank you. I hope that was helpful. I can answer questions, whatever you'd like, Sherry.
Yeah, well, I will say I did not pay Lori to say any of this. This is all from her heart and what she believes you all needed on their journey. And that's what I love about our accredited programs and the program directors that lead them, is that they truly have a lot of passion. I'm going to say they've got some passion for accreditation as well. And so thank you, Lori, for talking about your journey. And so I know we've got some colleagues from across the country on the call. Do we have any questions that you want to ask Lori while we've got her here today?
I have a question, if that's okay.
Yeah, go for it.
Hi, Lori. Thanks so much for your talk. It was great. I'm Ashley. I'm from SUNY Upstate up in Syracuse, New York. And we're very similar to you in the sense of our fellows are hired. They're fully benefited. They're part of our union. My question was, how do you get them to start in certain cohorts? Right now, ours is kind of whenever they clear credentialing with med staff is kind of when we can get them in. So I was just curious if you would mind speaking to that.
Sure. That's the challenge. And so it is something we've had to address with primary care, because sometimes that means that they might have to wait a few months before they start. One thing that we've done, because we are only a primary care and we are not specialty, so they do not have to, they have to be credentialed with payers, but not in the hospital. What we have done is we have, if they're on that border, even though they're technically not credentialed with payers for about 90 days, because we do all of our didactic up front and then the rotations, most of the time, if they're hired within a month, we know their credentialing will come through while they're in that didactic course. So we do try to kind of fit people in as quickly as we can, but it does cause some delay for some. And so thankfully, it hasn't been a big problem, and it hasn't currently held any practices up because we do have 3 start times. And so because of that 90-day period, it kind of works out with credentialing, but that's how we've addressed it.
Thank you.
Any other questions for Lori?
Hi, can you hear me?
Yep.
Mm-hmm. Yeah.
Okay. Thank you, Lori, for your presentation. My name is Tanya. I'm in this new role since June. The previous program director retired back in November, kind of similar to your situation. She basically taught me everything I know. I recently gave an update to our CNO, and I've been tasked to grow the program and to create a business case. Currently, we are in our cohort number 6, but we only have 1 APN per year. It's in the internal medicine service line. And we need to try to figure out how to grow the program. I've reached out for grant funding at the foundation here at the organization. I've also reached out to some team members in regards to what I hear about CMS reimbursement. And I was wondering if you had any information about that, or how, if you can speak to how to grow a program with in a situation where you just have 1 APP.
Sure. And I'm not an expert in this, so I can kind of touch on a couple of things. While we did not receive it because not unfortunately, we're probably in a little bit too much of an urban area, we did apply. There is a HRSA grant specifically for APP fellowship programs, and we did apply for that last year. We were so close, but we, like I said, we're probably not quite rural enough, didn't have enough qualifying centers. But that would be one thing. The other thing is be creative with your money. Are your APP fellows employed, or are you bringing them in as a traditional fellowship?
So they are employed with benefits.
Okay.
So their salary is basically as a new graduate.
Perfect. Yeah, so are ours. So we have a $2,500 CME allowance for APPs at Community Health Network, and our APP fellows, they know coming into it, we take that CME allowance for the first year, and that all goes toward payment of the didactic portion of our program. We also require our APP fellows to sign a 2-year commitment. So by just bolstering retention, we've been able to grow the program because our executives see the financial benefit of that on the other side. But probably the biggest thing that we did was show our productivity data. And when we showed our productivity data to our executive team, our APP fellows were 2 to 3 times more productive after their training than those who had not gone through a fellowship.
Got it. Thank you so much.
And just so you know, Tanya and everyone on the line, I just dropped a link to an article that an amazing APP did for me earlier this year, Holly Smith, and they actually at their organization created the universal APP program. So any new grad that comes into their system has to go through an APP fellowship program, because they found that by supporting them, it actually costs them less money than losing that provider because of turnover, et cetera. So it's a great article. I know it might not solve everything. It might blow up your world, Tanya. So I don't know if you want to step on that landmine, but it's just a different way of looking at APP fellowships. I will say in the 10 years that we've been looking at APRN programs and now APP programs, a lot of them start with 1 or 2 individuals in the program and they're slowly growing, but then we've also seen programs that have just exploded and they've got tons of people going through them because of the need of the organization. So it might be beneficial for you to look at your turnover rates of APPs and your turnover rates to see how much that's costing you to then backfill that position and then get that new provider up and running. Whereas if you just paid for that fellow, you could have potentially you could have supported them throughout that time that you have them in a fellowship program and kept them. So just a couple different ways to look at things. So lots of different ways to say. Yeah, absolutely. Any other questions for Lori? Well, I want to thank Lori for her amazing, honest review of the accreditation process. And I want to say there are so many individuals like Lori out there that are kind of put in the hot seat of being an APP fellowship director with, I'm going to say, putting their swimmings on in the deep end. And as she said earlier, if she can do it, you can do it. I'm confident that those of you that are embarking on starting an APP fellowship program and then considering accreditation, will let us know. I know our team is here to support you. We can always clarify the standards and clarify eligibility, but the one thing, unfortunately, my team can't do is coach you and consult for you. So just keep that in mind. But there are people like Lori and others in this amazing world that can, I'm not going to say Lori can consult for you, but there are people out there that will help give you some pro tips. So thank you so much, Lori, for your time and your candidness about your process. And thank you everyone for joining us today. And I hope to see some of you down in New Orleans at the end of April. So everyone have a wonderful day and enjoy the rest of this wonderful February. Have a great day, everyone. Bye-bye.
Thank you. Bye-bye.